Okay, I guess this will teach me not to submit the form at 11:58 on Friday morning, but I didn't do that. I'm kidding. Okay. So my name's Darryl Byers. I'm a social worker with the Hamilton Wentworth District School Board. Part of my role with the school board is to support LGBTQ students and families. That's part of my position as the system social worker for LGBTQ. I'm here today in my role as a part of the Queer and Trans Youth Collaborative, a group of Hamilton service providers representing education, mental health services, shelters, healthcare providers, child welfare, child and youth services, outreach services, and Indigenous services, who first came together in June 2015 in response to the concerns around the unique issues and challenges experienced by LGBTQ youth. And we've recruited youth to provide feedback and work alongside the collaborative, and they meet together as the Rainbow Youth Collaborative, and you heard from them earlier. So we hope that this protocol will help to build a framework for creating safer spaces and locations where these youth interact and interface with the City of Hamilton in order to augment the sense of community. After all, it's hard to feel that you are part of the community if you don't feel welcome in all the spaces in the community. In this way, the protocol is not simply about issues of access to facilities, but asserting that trans rights are human rights. This is a human rights issue first and foremost. So key points that have arisen in our work with transgender and gender non-conforming youth, both in our individual agencies and in consultation with the youth in the Rainbow Youth Collaborative, include the impact of discrimination, both direct and systemic, such as the prevalence of the gender binary and frequent misgendering, and the need for agencies and organizations in Hamilton to develop better policies and practices, including opportunities for input from those populations most impacted, and procedures for ongoing assessment and improvement to ensure that they are providing safe and inclusive services to transgender and gender non-conforming clients, patients, and service users. There are a plethora of statistics that demonstrate the adverse effects of discrimination and transphobia on transgender and gender non-conforming individuals, including youth. I'm not going to go through all the statistics because you've heard those throughout the day today. But while these findings present clear evidence regarding the need for better access to relevant, effective mental health and other interventions broadly, there are several specific implications. LGBTQ youth are particularly high risk and have unique needs as a function of sexual and gender identity considerations and the systemic discrimination they face. We support the protocol as a good starting point to address some of the issues transgender and gender non-conforming individuals experience. And moving forward, we hope that there exists some additional meaningful opportunities to address these inequities. This includes having trans voices included in the process to develop policies and procedures that will impact on them, as well as other organizations following up on this and examining their own practices and creating policies to address inequities, again, being sure to take their direction from transgender and gender non-conforming people. Thank you.
Thank you. Thank you, Darryl. And are there any questions for the presenter? Seeing none, thank you very much. And Darryl is our